Anxiety syndrome. Introduction. Anxiety syndrome, often referred to simply as anxiety disorder, is a prevalent and complex condition affecting millions of individuals worldwide. It encompasses a range of mental health disorders characterized by excessive fear, worry, and behavioral disturbances. These disorders can significantly impact an individual's daily life, causing distress and impairing their ability to function in social, occupational, and other important areas. This comprehensive essay delves into the various aspects of anxiety syndrome, including its types, causes, symptoms, diagnosis, treatment options, and coping strategies, aiming to provide a thorough understanding of this condition. Understanding anxiety syndrome. Definition and overview. Anxiety syndrome refers to a group of mental health disorders characterized by significant and persistent feelings of anxiety and fear. Unlike normal anxiety, which is a natural response to stress or danger, anxiety syndrome involves chronic and excessive worry that interferes with daily activities. The primary types of anxiety disorders include generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, specific phobias, and separation anxiety disorder. Each type has unique features, but they all share common symptoms of anxiety and fear. Types of anxiety disorders. 1. Generalized anxiety disorder, GAD. GAD is characterized by excessive, uncontrollable worry about various aspects of daily life, such as work, health, and social interactions. Individuals with GAD often find it challenging to control their worry, which can lead to physical symptoms like restlessness, fatigue, and muscle tension. 2. Panic disorder. Panic disorder involves recurrent, unexpected panic attacks, sudden periods of intense fear or discomfort that peak within minutes. Symptoms include palpitations, sweating, trembling, shortness of breath, and a fear of losing control or dying. These attacks often lead to persistent concern about future attacks and behavioral changes to avoid them. 3. Social anxiety disorder, social phobia. Social anxiety disorder is characterized by an intense fear of social situations where individuals may be scrutinized or judged by others. This fear can lead to avoidance of social interactions, affecting personal and professional relationships. 4. Specific phobias. Specific phobias involve an intense fear of a particular object or situation, such as heights, spiders, or flying. The fear is disproportionate to the actual danger and can lead to avoidance behaviors that interfere with daily life. 5. Separation anxiety disorder. Although commonly associated with children, separation anxiety disorder can also affect adults. It involves excessive fear or anxiety about separation from attachment figures, leading to distress and impairment in daily functioning. Causes and risk factors. The development of anxiety syndrome is influenced by a combination of genetic, environmental, and psychological factors. Understanding these causes and risk factors is crucial for identifying individuals at risk and developing effective prevention and treatment strategies. Genetic factors. Research suggests that anxiety disorders have a hereditary component, meaning they can run in families. Twin and family studies indicate that genetic factors contribute to the development of anxiety disorders, though the specific genes involved are not yet fully understood. Genetic predisposition interacts with environmental factors to increase the likelihood of developing anxiety. Neurobiological factors. The brain plays a significant role in anxiety disorders, with particular emphasis on the amygdala, prefrontal cortex, and hippocampus. These brain regions are involved in processing fear and regulating emotions. Dysregulation in the neurotransmitter systems, including serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, is also implicated in anxiety disorders. Environmental factors. 1. Trauma and stressful life events. Exposure to traumatic or stressful events, such as abuse, neglect, the death of a loved one, or major life changes, can trigger the onset of anxiety disorders. The impact of these events can be long-lasting, leading to chronic anxiety. 2. Family environment. A family environment characterized by high levels of stress, overprotection, or lack of emotional support can contribute to the development of anxiety disorders in children and adolescents. Parental anxiety can also influence the development of anxiety in offspring. 3. Socioeconomic factors. Socioeconomic factors, such as poverty, unemployment, and lack of access to healthcare, can increase the risk of developing anxiety disorders. Financial stress and social disadvantage can exacerbate feelings of helplessness and anxiety. Psychological factors. 1. Personality traits. Certain personality traits, such as neuroticism, a tendency to experience negative emotions, and perfectionism, are associated with an increased risk of anxiety disorders. These traits can influence how individuals perceive and respond to stressors. 2. Cognitive factors. Negative thinking patterns, such as catastrophizing, expecting the worst to happen, and excessive rumination, overthinking problems, can contribute to the development and maintenance of anxiety disorders. Cognitive distortions can amplify feelings of anxiety and hinder coping efforts. Symptoms and diagnosis. Common symptoms. Anxiety disorders manifest through a variety of physical, emotional, and behavioral symptoms. While the specific symptoms can vary depending on the type of anxiety disorder, common features include: 1. Physical symptoms. Palpitations or rapid heartbeat. Sweating and trembling. Shortness of breath or hyperventilation. Muscle tension and headaches. Dizziness and lightheadedness. Gastrointestinal issues, such as nausea or stomachaches. 2. Emotional symptoms. Excessive and persistent worry. Fear or apprehension. Irritability and restlessness. Feelings of impending doom or danger. 3. Behavioral symptoms. Avoidance of anxiety-provoking situations or activities. Difficulty concentrating or staying focused. Sleep disturbances, including insomnia or restless sleep. Changes in eating patterns, such as loss of appetite or overeating. Diagnostic criteria. The diagnosis of anxiety disorders is typically based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. To receive a diagnosis, individuals must meet specific criteria related to the duration, severity, and impact of their symptoms. The diagnostic process often involves: 1. Clinical interviews. Clinicians conduct thorough interviews to gather information about the individual's symptoms, medical history, family history, and psychosocial factors. Structured or semi-structured interviews may be used to ensure a comprehensive assessment. 2. Self-report questionnaires. Self-report questionnaires, such as the Generalized Anxiety Disorder 7, GAD-7, scale or the Beck Anxiety Inventory, BAI, can help quantify the severity of anxiety symptoms and aid in the diagnostic process. 3. Physical examinations. Physical examinations are conducted to rule out medical conditions that may mimic or contribute to anxiety symptoms, such as thyroid disorders or cardiovascular issues. 4. Observation and behavioral assessments. Clinicians may observe the individual's behavior and conduct behavioral assessments to identify specific triggers and patterns of anxiety. Treatment options. Effective treatment for anxiety disorders typically involves a combination of psychotherapy, medication, and lifestyle changes. The goal is to reduce symptoms, improve functioning, and enhance the individual's quality of life. The choice of treatment depends on the type and severity of the anxiety disorder, as well as individual preferences and needs. Psychotherapy. 1. Cognitive behavioral therapy, CBT. CBT is the most widely used and evidence-based psychotherapy for anxiety disorders. It focuses on identifying and challenging negative thought patterns and behaviors that contribute to anxiety. CBT techniques, such as cognitive restructuring, exposure therapy, and relaxation training, help individuals develop healthier coping strategies. 2. Exposure therapy. Exposure therapy, a component of CBT, involves gradually and systematically exposing individuals to anxiety-provoking situations or objects. This process helps desensitize them to their fears and reduces avoidance behaviors. Exposure therapy is particularly effective for specific phobias and social anxiety disorder. 3. Acceptance and commitment therapy, ACT. ACT emphasizes acceptance of anxiety-related thoughts and feelings rather than attempting to eliminate them. It encourages individuals to commit to actions aligned with their values and goals, despite the presence of anxiety. Mindfulness and cognitive diffusion techniques are often used in ACT. 4. Dialectical behavior therapy, DBT. DBT, originally developed for borderline personality disorder, has also been adapted for anxiety disorders. It combines cognitive behavioral techniques with mindfulness and emotional regulation strategies. DBT skills training helps individuals manage anxiety and improve interpersonal effectiveness. Medication. 1. Selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as sertraline, fluoxetine, and escitalopram, are commonly prescribed for anxiety disorders. They work by increasing serotonin levels in the brain, which can help regulate mood and reduce anxiety symptoms. SSRIs are often the first-line medication for generalized anxiety disorder, social anxiety disorder, and panic disorder. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs, such as venlafaxine and duloxetine, increase both serotonin and norepinephrine levels in the brain. They are effective for generalized anxiety disorder and can also be used for other anxiety disorders. 3. Benzodiazepines. Benzodiazepines, such as diazepam, lorazepam, and clonazepam, are fast-acting medications that can provide short-term relief from acute anxiety symptoms. However, they are typically prescribed for short durations due to the risk of dependence and tolerance. 4. Beta blockers. Beta blockers, such as propranolol, are used to manage physical symptoms of anxiety, such as palpitations and trembling. They are often prescribed for situational anxiety, such as performance anxiety. 5. Buspirone. Buspirone is an anxiolytic medication that is less sedating and has a lower risk of dependence compared to benzodiazepines. It is commonly used for generalized anxiety disorder. Lifestyle changes and self-help strategies. 1. Regular exercise. Physical activity, such as aerobic exercise, yoga, or walking, can reduce anxiety by promoting the release of endorphins and improving overall well-being. Regular exercise also helps reduce muscle tension and improve sleep quality. 2. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support mental health. Avoiding excessive caffeine, alcohol, and sugar can help stabilize mood and reduce anxiety symptoms. 3. Sleep hygiene. Establishing a regular sleep routine, creating a calming bedtime environment, and avoiding screens before bed can improve sleep quality and reduce anxiety. 4. Mindfulness and relaxation techniques. Mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help individuals manage anxiety by promoting relaxation and reducing stress. 5. Social support. Building and maintaining a strong support network of family, friends, and support groups can provide emotional support and reduce feelings of isolation. Coping strategies. In addition to professional treatment, individuals with anxiety disorders can benefit from developing effective coping strategies to manage their symptoms and improve their quality of life. Cognitive coping strategies. 1. Cognitive restructuring. Cognitive restructuring involves identifying and challenging irrational or negative thoughts that contribute to anxiety. Replacing these thoughts with more realistic and positive ones can reduce anxiety and improve emotional well-being. 2. Problem solving. Developing effective problem-solving skills can help individuals address and manage stressors that contribute to anxiety. Breaking down problems into manageable steps and generating potential solutions can reduce feelings of overwhelm. Behavioral coping strategies. 1. Exposure and desensitization. Gradually facing and confronting feared situations or objects can reduce anxiety over time. This process, known as exposure therapy, helps individuals build confidence and reduce avoidance behaviors. 2. Time management. Effective time management skills can reduce stress and anxiety by helping individuals prioritize tasks, set realistic goals, and avoid procrastination. 3. Relaxation techniques. Practicing relaxation techniques, such as progressive muscle relaxation, guided imagery, and deep breathing exercises, can promote physical and mental relaxation. Emotional coping strategies. 1. Emotional regulation. Developing skills to manage and regulate emotions, such as identifying and labeling emotions, practicing self-compassion, and using grounding techniques, can help individuals cope with anxiety. 2. Expressive writing. Writing about thoughts and feelings related to anxiety can provide an emotional outlet and help individuals gain insight into their experiences. 3. Engaging in pleasurable activities. Participating in activities that bring joy and fulfillment, such as hobbies, creative pursuits, and social interactions, can enhance emotional well-being and reduce anxiety. Conclusion. Anxiety syndrome is a multifaceted condition that encompasses various types of anxiety disorders, each with its own unique features and challenges. Understanding the causes, symptoms, and treatment options for anxiety disorders is crucial for individuals, healthcare providers, and society as a whole. With the right combination of professional treatment, lifestyle changes, and coping strategies, individuals with anxiety disorders can manage their symptoms, improve their quality of life, and achieve a sense of well-being. The journey to managing anxiety may be challenging, but it is also an opportunity for growth, resilience, and self-discovery. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.